Okay, let's dive right in. Welcome to today's Explainer, where we're going to map out absolutely everything you need to know about one of the most widely used medications in the world. We are demystifying metformin. So whether you've just been prescribed it, or maybe you've actually been taking it for years and just want to truly understand what it's doing inside your body, you are in the exact right place. Let's build your medical map. Here's our roadmap for today. First, meet metformin, the basics. Then, who should avoid it? 3. Dosing and daily routine. 4. Navigating side effects. And finally, pregnancy and interactions.
All right, Section 1, meet metformin, the basics. Let's get to really understand your new medication. So what exactly is metformin anyway? Well, at its core, it's a medicine primarily used to help control and sometimes even prevent type 2 diabetes. It's also utilized to treat gestational diabetes, which is a specific type that happens during pregnancy. And sometimes, doctors use it off-label to help manage PCOS, or polycystic ovarian syndrome. But for our focus today, we're going to be looking primarily at its absolute superpower, which is battling diabetes.
To understand the cure, we really have to understand the problem first. In type 2 diabetes, the cells in your muscles, your fat, and your liver actually become resistant to a hormone called insulin. You can think of insulin kind of like a key that's meant to unlock your cells to let sugar in. When your cells resist that key, too much sugar just gets left floating around in your bloodstream. Now, gestational diabetes is very similar, but it's a transient form that occurs during pregnancy, and it often just disappears after giving birth.
So how does metformin actually step in and fix this? It acts as a super powerful two-step solution in your body. Step 1, it improves the way your body handles the insulin you're already making, basically pushing back against that cellular resistance. And Step 2, it directly reduces the amount of sugar that your liver is releasing into the bloodstream in the first place. By tackling the problem from both of these angles, it effectively drives those blood sugar levels down. And you know, knowing exactly how this works puts you directly in the driver's seat of your own health.
Moving on to Section 2, who should avoid it? Safety first and contraindications. Now, while this medication is incredibly common, it definitely isn't for everybody. You should avoid it if you've ever had an allergic reaction to it, or if you currently have uncontrolled diabetes, liver or kidney problems, or a severe infection. It's also strictly contraindicated if you're being treated for heart failure, maybe you recently had a heart attack, or if you experience severe circulation or breathing difficulties, or consume heavy amounts of alcohol. This is just a factual checklist to make sure your doctor matches the exact right treatment to your specific body. There's also a very specific kind of situational warning to keep in your back pocket. Even if you are a perfectly healthy metformin user, you might need to pause your medication before having surgery that involves a general anesthetic, meaning you're put to sleep, or before certain medical tests, specifically scans that use an injection of a dye containing iodine. You'll want to always speak directly to your doctor regarding any upcoming medical procedures so they can tell you exactly when to pause and restart your meds. Let's move to Section 3, dosing and daily routine. How to take your medication safely. Metformin generally comes in two main tablet types, and it is super important to know the difference. Standard tablets release the medication into your body quickly, meaning you might need to take them a few times a day based on your doctor's orders. Slow-release tablets, on the other hand, well, they work gradually over time, so you don't have to take them nearly as frequently. And here's a great practical tip for you. If you start on standard tablets and find that the everyday side effects are just a bit too much, your doctor might easily be able to switch you over to the slow-release version to smooth things out. And that brings us to this massive number, 2,000. That is the typical maximum daily dose in milligrams, which is the equivalent of a whopping 2 full grams a day. While tablets are definitely the most common form, it's worth noting for accessibility that liquid and powder sachet forms absolutely do exist. The liquid usually comes in 5 milliliter doses, ranging from 500 to 1,000 milligrams. So if you're someone who just really struggles to swallow pills, rest assured you definitely have options. Let's quickly lock in those daily routine steps. Typically, you're going to start with a low dose and increase it slowly over time, just to reduce any side effects. Always try to take your tablets with or right after your evening meal. Swallow them completely whole with a drink of water. Definitely do not chew them. If you're using the power sachets, just pour it into a glass, add about 150 milliliters of water, stir it until it's clear or maybe slightly cloudy, and then drink it straight away. And crucially, if you ever accidentally miss a dose, just skip it. Just take the next one at your usual time. Never ever double up to try and make up for a missed pill. And don't stress about getting it perfectly right on day one. Your doctor's going to be regularly monitoring your blood sugar levels and tweaking this dosage if they need to.
Section 4.
Navigating side effects, what to expect and when to act.
Like all medicines, metformin can cause side effects, though certainly not everybody gets them. The most common ones happen in more than 1 in 100 people. These include things like feeling nauseous, vomiting, experiencing diarrhea or a stomachache, loss of appetite, and a rather unique one, some people actually notice a distinct metallic taste in their mouth. These are just manageable facts of the medication. And honestly, taking it with your evening meal, just like we discussed a minute ago, is a fantastic strategy to help minimize these common issues.
Another thing to keep an eye out for over the long term is your vitamin B12. Taking metformin can sometimes induce a B12 deficiency. Symptoms you'll want to watch for include feeling extremely tired right out of nowhere, having muscle weakness, developing a sore red tongue, or noticing unusual issues with your vision or physical sensation. If you experience any of these, don't panic. Your doctor can really easily check your B12 levels, and if they're too low, simply prescribe some vitamin B12 supplements in the form of a quick injection or a daily tablet.
Now, I know a lot of people worry about their blood sugar dropping dangerously low, an event known as hypoglycemia. The excellent news here is that taking metformin purely on its own rarely causes low blood sugar. However, the risk of a hypo definitely increases if you combine it with other diabetes medicines like insulin or gliclazide. So if you're taking a combination of meds, or if you're planning to exercise a lot more heavily than usual, you should always carry a fast-acting carbohydrate with you, like sugar cubes, maybe some fruit juice or sweets, just in case you start feeling that dip.
While we're on the topic of side effects, we do have to calmly touch on the severe ones. These are incredibly rare, happening in less than 1 in 10,000 people, but they absolutely require immediate medical attention. Seek urgent help if you experience a general feeling of extreme unwellness combined with severe tiredness, coldness, a slow heartbeat, or fast, shallow breathing. Also, watch if the whites of your eyes or your skin turn yellow, as that can be a sign of liver problems. Though keep in mind, this can be slightly less obvious on darker skin tones. Finally, any signs of anaphylaxis, like a suddenly swollen lip or tongue and difficulty breathing, mean you need emergency medical attention right away.
And that brings us to Section 5, Pregnancy and Interactions, Life Changes and Other Medications.
If you are planning to grow your family anytime soon, you can actually breathe a massive sigh of relief here. Metformin is generally considered totally safe to take during pregnancy, whether on its own or even combined with insulin, provided your doctor or midwife confirms your baby is healthy. It's also generally safe while breastfeeding. The medication does technically pass into breast milk, but only in these completely harmless, tiny amounts that haven't been linked to side effects in any breastfed babies. As always, just make sure to keep your healthcare provider in the loop with your family planning.
Finally, we got to look at the other things floating around in your medicine cabinet. Certain medications can completely change the way metformin works in your system. You absolutely must tell your doctor if you're taking steroid tablets like prednisolone, diuretics that make you pee more, heart and high blood pressure medicines, or hormones like testosterone, estrogen, or progesterone. Seriously, even starting a new contraceptive pill can change how your body naturally handles sugar. If you take any of these interacting medications, your doctor might just need to check your blood sugar levels a bit more frequently, or maybe make a minor adjustment to your metformin dose to keep everything perfectly in balance.
Which brings us to our final and frankly most important takeaway today: don't stop taking metformin without talking to your doctor. Suddenly stopping can cause aggressive blood sugar spikes, making things so much worse. Managing diabetes is a lifelong, collaborative partnership between you and your healthcare provider, and metformin is really just one tool in that toolkit. So armed with this brand new map of exactly how your medication works, what questions are you going to be bringing to your doctor at your next check-in? Stay curious, stay proactive with your health, and I will see you in the next explainer.